Hello, everyone. We're going to try something different. This is a video of the slideshow of the stuff that I'll be putting on the bulletin board. I'll also be leaving it on the break room desk. As you all know, we are highlighting triage, ESI, and the pivot model in our ER. So we are going to be focusing on highlighting different aspects of the ESI algorithm. Today, we're going to look at highlighting the ESI acuity level 2. How is that assigned? As we go through the slides, I'll be discussing some things that we want to look out for when we're evaluating somebody at a level 2 acuity. Also, to make this more interactive, there will be a prize a location told to you if you listen to this video about where it will be. So it'll be somewhere in this presentation. So in order to know where that prize is, and its location within our emergency room for listening to this video, you will have to listen to possibly the whole thing to figure out where that is. The prize could be anything. It could be a Starbucks gift card. It could be something from the gift shop in the hospital, or a free meal in the cafeteria, or whatever. So there will be a location of the prize. So make sure you're listening to the video, and the instructions are once you find it in the emergency room, that you will need to take a picture of yourself, a selfie with the prize, saying that you obviously listened to the video and you found it, and post your picture to the ER Facebook page. That will let us know that you got the prize and you listened to the video, and good for you. So hopefully that'll be done soon. So with no further ado, we will continue with our presentation on ESI Acuity 2. So ESI Acuity 2, in order to effectively understand that, this is basically the high-risk patient. This is an ESI level of acuity that asks the question, is the situation high risk? And we're looking at a few things here that basically focus us down in the ESI2 model for this area. If we are looking for the confused patient, the lethargic patient, or the disoriented patient, or in severe pain and distress. Patients at this level tend to need quick intervention and usually have unstable vital signs. These patients are particularly the intuition peaks is very high with the nurse that something is not right. So this would be basically a good definition of the ESI Acuity 2 level. So there are three questions you need to ask yourself when you're evaluating someone with an ESI level of acuity 2. The first two questions are paramount. What does that mean? Basically, these are the first two that are going to point us in the direction of a level 2 acuity. Is the patient at high risk? Okay, that could this patient deteriorate very quickly for us? Yes. Okay, so if you're answering yes to that question, then we're going to go into the second question. Is the patient confused, lethargic, or disoriented? So if these first two questions, the answer is no, then we need to consider a level 3 patient. If the answer is yes, then these patients we're going to go to the next question. Is the patient in severe distress or pain, self-reported pain or higher than 7, clinical observations, and severe distress? So obviously, if these three questions are answered quickly with a trained eye, then we're going to rate these individuals as a level 2 acuity. So these are some examples that are coming out of the ESI Severity Index book, which is also called the Triage Tool for Emergency Department Care, version 4. That's where all this is coming from. And these are some examples of level 2 acuity that we may often see in the ER. Example: active chest pain with suspicion of acute coronary syndrome, but does not require immediate life-saving interventions. So in other words, they're coming in, they're complaining of those classic chest pain symptoms. They may even look diaphoretic or their color is different. Needle stick in a healthcare worker, that is, according to this version, this is considered a level 2 situation. Signs of a stroke, but does not need level 1 immediate care. Rule out ectopic pregnancies. So we're looking for hemodynamically unstable patients. Patients on chemo, therefore immunocompromised with fever, suicidal or homicidal situations are at a level 2. Abdominal pain is often categorized as a level 3 acuity a lot of times. However, in this case, in this example, abdominal pain who is diaphoretic, tachycardic, and has elevated blood pressure, or a patient with severe flank pain, vomiting, pale skin, and a history of renal colic. Obviously, we're leaning in the direction of severe kidney stones or some other obstruction in the abdominal cavity that could cause some serious infection or maybe even internal bleeding. So that would be a good example of a level 2 acuity. More examples: an 88-year-old female with severe right lower abdominal quadrant pain. Vital signs are unstable. Obviously, the first thing that comes to mind there is the appendix. 45-year-old female who has been vomiting with a gastrointestinal bleeding and is tachycardic. We're looking at blood loss there, GI bleed. 35-year-old female with a sudden onset of possible palpitations, anxious heart rate, and heart rate of 160, SVT tach. Blood pressure is 120/70. So that's at level 2. 65-year-old female with sudden onset of breathing and discomfort for skin ischemia, chest pain for 3 hours. So we're looking at a possible MI there. 65-year-old female, sudden onset of vision loss. All complaints with sudden vision loss have occurred. That is considered a high risk. There could be some type of global rupture or some type of detached retina, or some sudden change could also indicate stroke. So any type of organ that is compromised suddenly like that would be a level 2. 9-month-old baby with vomiting and diarrhea. Baby is unable to drink, hasn't had wet diaper in several hours, is unable to hold anything down, has very dry mucous membrane. So this baby is at a level 2. Could deteriorate quite quickly. So as we go through these examples, we're looking at those 3 questions in our mind. And those questions are: is the patient high risk? Can they deteriorate? Is that patient confused, lethargic, or disoriented? Could any of those examples lead to that? Yes. It goes back to deterioration. And number 3, is the pain severe? And are they in distress? So those are the 3 questions we have to look at when we focus in ESI 2. So high risk, lethargic, disoriented, confusion, and are they in distress and pain? So one of the things that comes up typically in our ER and all ERs is chest pain. Is chest pain always a level 2? So anytime somebody comes on the radio and they basically say chest pain, I immediately have this expression of an eye roll, because 90% of the time chest pains are not true chest pain. So with that being said, let's talk about chest pain. So I went too fast there. So chest pain, all chest pain is not always an acuity 2. So we're going to do an EKG. So that decision making from the triage nurse is going to determine some type of a cardiac event, some ischemic event, high risk cardiac issue. Patients who have an episode of chest pain or epigastric discomfort without accompanying symptoms usually need an EKG pretty rapidly. That's why we do the EKG there. We do that quickly. We get them back to the room quickly. The pivot nurse is getting them back there. They may see signs, hemodynamically unstable signs, in addition to making sure that they get the EKG. So the EKG is to rule out immediate ischemic events in a level 2 chest pain acuity. So we're looking for that hemodynamically unstable patient. Not all chest pains meet the level 1 or even a level 2 criteria. For example, 20-year-old healthy patient with a chest pain, normal oxygen saturation, cough, and a fever under 1 is at low risk for acute coronary syndrome. However, if we have a patient that's 20 years old and has chest pain and says they've been using cocaine, that's a different story. So the risk factors change. It goes back to those 3 questions. Is the patient going to deteriorate? Possibly, yes. Is the patient confused? Is the patient lethargic? Is the patient disoriented? Is the patient at high stress? Is the patient going to have severe pain? So in that case, when you see a chest pain that is legit, you know what that looks like, and you see the signs, and then they're going to get bedded. So the nurse's role in the ESI acuity. So before we begin with this section of the slide, I want to announce the prize and its location. The prize is a free Chick-fil-A meal. Okay, there's a gift card. It's going to be in the first drawer to the right of the refrigerator in the break room. And it's going to be inside that drawer somewhere. So if you get that prize, you need to take a selfie and post it to the Facebook page for Piedmont Walton ER. And that lets us know that you watched the video and you listened and you found out where your prize was. So good for you. Thank you for participating. So let's move on. ESI level 2, unlike level 1 patients, the MD does not need to be immediately at the bedside. The emergency nurse can initiate care through protocols without a physician immediately at bedside. The triage nurse should also consider the question, would I give my last open bed to this patient? If the answer is yes, then the patient meets the level 2 criteria. The nurse recognizes that the patient needs intervention, but is confident that the patient's clinical condition will not deteriorate. So it goes back to those 3 questions. Is the patient going to deteriorate? It's very possible. That's a level 2. ESI level 2, the nurse can initiate intravenous access, administer supplemental oxygen, obtain an EKG, and place the patient on a cardiac monitor, all before the physician gets there. Although the physician does not need to be present immediately, the provider should be notified that the patient is in the room and that they are considered level 2. So in summary, with ESI level 2, the role of the triage nurse is to gather subjective and objective information from the patient, analyze it, and decide whether or not the patient is at high risk. Okay, so that is the highlighting ESI level 2. Again, that goes back to the 3 questions. Is the patient going to deteriorate quickly? Could they deteriorate quickly? Is the patient lethargic, disoriented, confused? If those 2 questions are not answered, they move to decision making D, which is level 3. If they look like they're going to deteriorate and answer all those 3 questions, then they're level 2. And good for you, whoever found the prize. So just remember, level 2s, even though one of these pictures is definitely not a level 2, it's a level 1, but I figured I'd throw it in there because it was kind of cool. So predictors of bad outcomes, chest pain, for example, sepsis is a good example of a level 2. Severe sepsis. Let's see, diabetes. Trauma to any organ, severe trauma like this. Nail gun in the eye. I figured I'd show those pictures with y'all. I might enjoy that. But I think our ankle there is going to be probably one. But anyway, it was a cool picture. So thank you for participating. Have a great day.